Hello, I'm Dr. Tech, and I'm here to talk about probably the most common problem that my patients seek help with, the carpal tunnel syndrome. We often spend long hours working on our computers or performing repetitive tasks and chores, thus putting our hands under constant strain. But did you know that your hands might be trying to tell you something? So now let's explore the warning signs of carpal tunnel syndrome, a condition that affects millions worldwide. Firstly, let us understand what carpal tunnel syndrome is. So the carpal tunnel is a narrow passageway in the wrist through which structures like a tendons and the median nerve pass through. And when this tunnel becomes narrowed, or when the contents are inflamed, it can compress the median nerve that might lead to carpal tunnel syndrome. So recognizing the signs and the symptoms of carpal tunnel syndrome is very crucial for early intervention and also to avoid surgery. Early warning signs may include persistent tingling or numbness in the fingers, especially of the thumb, the index finger, the middle finger, and half of the ring finger. As the condition progresses, you might experience not only pain but also weakness and loss of dexterity, and lastly muscle atrophy in very advanced cases. So that tasks that once felt effortless may become very challenging, and you may notice changes in sensation and very difficult to work with. If you're experiencing any of these warning signs, it is important to seek medical evaluation and treatment. Physical exams such as the Nelson sign, the Board-certified test, and diagnostic tests like electromyography and nerve conduction studies may be performed to confirm the diagnosis and assess the severity of the condition, while also trying to rule out other disease entities that present the same way. While treatment options for carpal tunnel syndrome vary, there are several preventive measures and self-care tips that you can incorporate into your daily routine to help alleviate symptoms and reduce the risk of developing carpal tunnel syndrome. So these may include the use of an ergonomic station setup with breaks in between your work, stretching exercises, and also lifestyle modifications. If you have been diagnosed with carpal tunnel syndrome, it is essential to seek treatment promptly. Non-surgical options such as splint medication and combination of physical therapy may be recommended initially to alleviate the symptoms and improve hand function. In very severe cases, surgical option might be the only way, such as carpal tunnel release surgery. Carpal tunnel syndrome is a common condition, but with early recognition and appropriate treatment can effectively manage symptoms and prevent long-term complications. So remember, you have to listen to your body and prioritize your hand health. And if you are experiencing symptoms of carpal tunnel syndrome, do not hesitate to schedule a consultation with us at Tech Orthopedics, and also visit our website techorthopedics.com to schedule your appointment today. Thank you and